Hey, what's going on, everybody? This is David Brooks, the Cadillac Counselor, tuning in today. You know, I always come in somewhere around noon. I wouldn't say right at noon, but noonish, all right? Today, we are talking about just insurance issues that we are having in our lives, especially in the state of Maryland. We are also going to talk about the deaf community and a lot of the issues that are going on in that community, especially in knowing in Frederick, we have a school for the deaf, and there's a big population, and the young lady that I have here with me, she has been part of my life since I got into Frederick. At that time, she was. We went to a church that she was managing, and it was a blessing for us. When I say it was a blessing for me and my wife, we've gotten many blessings out of that. We've even had words that were spoken to us during that time 10 years ago that was speaking into our life about starting a business right now. So the prophecies that came out of that church and the words and the friends that we've continued to have them for a long time. So we're just going to be having fun with you guys. And to be honest, you guys have been continuously staying with us and logging in. And today, I promise you, it will be an awesome show. So I don't want to belabor this. I want you guys to meet this young lady named Mary Ellen. So Mary Ellen, it's good to have you on today.
Wonderful to be here. Oh, wait, I'm going to sign. It's wonderful to be here. Thank you.
Oh, see, hey, she's even given us a little signing today. So you never know what's really going on and what you'll get here. So Mary Ellen, tell me a little bit about you and kind of where you're at in life right now.
Okay, well, first, if we're focusing today on the deaf community, I'll just say that I moved here in 1980 from New York. I moved to Frederick to teach at the School for the Deaf. So I have loved deaf culture, deaf people, since I was in my early 20s. And I love Frederick. I love the people of Frederick, and especially the deaf community.
Good. You know, Mary Ellen has her own practice. She even, what's so crazy is she interned with me when I worked at the jail. She came in and interned for a semester or two, and she was wonderful then. And she's went the course of getting her license and getting everything going. And honestly, now she is being able to do it on her own. And I think that's awesome. I commend you on starting your own practice. And yeah, definitely. So whenever you think about, when you think about the deaf community and some of the things that are going on, what are some of the major issues, especially during the COVID, for the deaf community?
Okay, well, first I would say for hearing people, sometimes we have a lot of misconceptions about deaf people. In the past, deaf people were thought of as not able to read, write, really function in society. And that's all gone, thank God. Mm-hmm. But there are still some hearing people who don't understand, okay? So I'm just going to explain that deaf people are very intelligent. There's a dentist who's deaf who works in Gaithersburg, Maryland. Deaf people are very bright and talented. So that's important for us to know. When we meet people in the streets, when you see deaf people signing, they're limited with hearing. Mm-hmm. And that's all. But they have a culture, they have their language. And in terms of COVID-19, I would just say that, we, were required to have our masks on. So I don't have my mask right here, but the mask, it would cover my mouth. And so an important part of the whole communication process is my hands with ASL, but also my face, my mouth with words. So deaf people with masks, with us, they're not going to see that. Now, among themselves, they're so ASL is their first language. So their hands communicate beautifully language.
Okay.
But it's important to have our mouth, and the whole face is part of the communication process. So I would just say that that's a limitation. In my office, I see deaf clients, and I'm right now working with a deaf couple, but doing Zoom for marriage counseling just felt awkward. So they come into my office, and we have everything clean, and it's been working really well. So I like for communication to always be its best.
Okay.
And if deaf clients prefer coming into my office right now, I'm great with that.
Good. I had a couple years ago, I had a client that was deaf. And this was really before the swing of substance use in the deaf community. And this young man would always ask to come through the back door. And so I remember I had an interpreter with me, and we would talk, and I just kind of was like, why do you keep wanting to go through the back door? And what he said is that when you have a substance use problem, that sometimes the other deaf community will alienate you as being a bad person. And so he would always want to come through the back and leave through the back because he didn't want someone from the community, the deaf community, to see him coming out of treatment. So my question to you, Mary Ellen, is within substance use, what are some of the issues that you might see, or even stigmas that are in the population of the deaf community?
Well, there's a law that was set up, I think it was 1970 something, that it's a law that interpreters must be present with a deaf client for doctor's appointments, everything that they would need to go to for appropriate communication.
Okay.
And unfortunately, I have seen doctors' offices try not to do that because they're trying to avoid paying interpreters. So that's still an issue now. Some offices are amazing. They have on staff, well, not really on staff, but on call, an interpreter that would come in to the office. So with substance abuse, same situation, like suppose a person needs to go to rehab. They're going to need an interpreter with them one-on-one, with groups.
Wow.
And that is a necessity. It's not something that should be avoided, or it has to happen, because if they're going to get the information and the interaction that they need to have an interpreter there with them.
Wow. So, I mean, a lot of times we look at the big population, like people get caught up in the whole going to rehabs, going to meetings and all of that. And we look at opioids, we look at all of these types of facets in the substance abuse world. But a lot of times we forget about these small little populations that aren't getting, like if we look at the big scale isn't being served. So imagine if you fall into this little small sector, it's even more hoops that you have to jump. How does that play out with those clients in the deaf community?
Well, I feel like you said it so well. It's just another hoop and then another hoop to jump through, because like I said, it's no sense for them to show up in a program without communication. So, right now I'm actually investigating a program to see what they have, how are they going to include the interpreter, and how that's going to be worked out, how is it going to be paid for. There's many different variables, right? I remember interpreting here in Frederick for an AA meeting, and it was a small meeting, and it was really good because I was there, and it was kind of cute because the other AA members wanted to chat with this individual.
Yeah.
And they couldn't do that without an interpreter, right? So they would come up and be like, tell this person this, and then, but it was so beautiful because you all know the value of support, right?
Yeah.
You can't go into a meeting and be alienated. You want to be included. And so that's the communication component that is a necessity.
Well, I mean, it sounds like we might even need to get like meetings that might just be for the hearing impaired, that might give them that opportunity to get that moving. We might have to talk about that and try to get something moving in that world. So if anybody out there has some information or would like to put that kind of thing together, definitely get at me or Mary Ellen and see about trying to figure out how to bring in a different type of style of group or maybe a different style of meeting for those people that are suffering with hearing loss. So also you even told me that like there are some cities who are really forward in the deaf community. Like there's centers that are being put together. There's even, like whenever there's a ambulance or fire truck coming in, they can't hear. What are some of these new innovative things that are coming out for the deaf community?
Well, in Frederick County, we have approximately 50,000 deaf individuals living here.
Wow.
And yes, there's work in motion to set up a deaf community center where they could have meetings, speakers come in, perfect place to have AA meetings, to have a support in our town. And, what better place than Frederick, because we are a real hub for the deaf community. So like David was saying, yes, already in Sacramento, California, and Las Vegas, Nevada, they have already set up community centers.
Wow.
And that's such a beautiful thing. So I am so excited to see that come here to Frederick, hopefully in the future. Yeah, and so in Rochester, New York, there are about 90,000 deaf people who live there. It's a very strong deaf community there in New York, upstate. And they have developed a system where when a siren or an ambulance is coming through the town, for us hearing people, we know we can hear it, and so we move over. But for deaf people, they don't know what's happening. It's like, there can be commotion on the road. What's happening? They can't hear the sirens. So in Rochester, New York, they have developed lights that go off in a specific way that a deaf person would know. Oh, behind me, a siren. An ambulance is coming to go to the hospital. Move over. So that's a beautiful thing that I'm hoping will come here to Frederick as well.
Well, hey, if we keep on talking about it and we bring it out to the forefront, then now it's a problem, and that means that we have to have a solution. And so no one better than Mary Ellen to speak about it on the Cadillac Counselor tapings. So for the last thing that I wanted to talk about, and I'll talk to you guys too, is I've had some many struggles within the Medicaid, and we're both therapists. And so for me, my goal in helping people was to get the criminogenic stuff out there, to get the notion that we have a problem in our criminal system and we need to find a way to fix it. So I wanted to accept. At first, I only accepted Medicaid. That's all I saw was Medicaid. And so for some reason, I don't know if it was God or something, told me, listen, you might want to start picking up some commercial insurances. So I went out and I got paneled with, Aetna, Blue Cross Blue Shield, United Healthcare, Cigna, and those have started ramping up a little bit more and more as the months go by. And then all of a sudden in December, I go on vacation. I go to Florida to go to Disney. My accountant tells me, hey, it might be a good idea. It's the end of the year. Make sure that you buy all the things you need for your business so that you don't carry over a lot of money. So we bought things that we needed. We bought, things that we wanted. And then we come back from vacation and literally that first check that came out in January, we didn't get a check. And then we didn't get a check on that second week. So we were seeing people for 2 weeks or 3 weeks and we got no money for that. And we never stopped. We kept seeing the people because that's what my heart is. And then we're now looking at April and they put in this little bit of money that they just send us a check that is not exactly it's probably about less than probably 50%, maybe 40% of what we really earn. And so for me, my Dr. Haber, we haven't had that. We couldn't bill him. So I've been literally paying him out of the business money. And so I had to make a decision because I asked them, when are you going to fix the computer error? When are you going to get this straight? They told me April 1st. April 1st came. Nothing. They still haven't fixed the problem. Still to this day, they haven't fixed the problem. So for me, I had to stop taking new Medicaid patients. I'm continuing to see the people that I already have. But what type of issues have you noticed within the change from Beacon Health to Optum? How has your life changed in your counseling?
Yeah, well, the minute it happened, payments stopped. So I didn't get paid, throughout the fall season. Nothing was coming to me from Medicaid. And I have like an insurance expert who works with me. And, it was just a nightmare. She was contacting them. Nobody would answer the phone. It's just like a zoo.
Yeah.
So anyway, nothing happened. And so I continued, like you, David, to continue to see all my people. I wasn't going to punish them for these people's, I'm sorry, but stupidity.
Yeah.
So then I remember we called the governor's office, and I really feel like we need to continue doing that really every day, like what's happening.
Yeah.
So now, like you said, they send me like a random check. And that probably represents, 1/3 of reality.
Yeah.
And it's so crazy. Like they'll send me a check for a specific amount in the hundreds.
Yeah.
And they always send a second check. This is hysterical, for like $6.35. I'm like, what is that? To send me a second check, a second stamp, a second paper envelope, right? So that just shows their system is just broken.
Really broken.
And I feel like we need to, develop a lawsuit, something, because it's really robbery.
Yeah.
We are working
for free.
For them.
Yeah.
And they are not paying us to see their clients. So it is a mess, David, and I will work with you in whatever way possible to help fix this problem.
And so we want to bring this awareness to you guys to understand that when I say that I'm not seeing Medicaid people or bringing in new Medicaid people or state insurance, it's not because I don't care about you guys. It's just it's not a really good business model. And when I say a business model, it's just, trust me, I've worked for months without getting the proper pay. And it's not really about the pay, but it's just keeping the business. And so then once COVID hit, my clients probably cut in half. Because clients just don't have internet connections. They are not savvy enough for technology, whatever it is. So that's already cut in half. So we're talking about my clientele cut in half. The payments that we have been receiving has been cut short. So there are therapists. I know at least 4 therapists that I know of that I contact that have no longer taken Medicaid. So if you want to know about a broken system, this here is the base. We already have a broken system over the top, and then underneath it all, the Medicaid is still broken. So how can we as therapists or people who love to help people, how can we do it whenever you're not getting paid? And people constantly tell us but don't you want to help the people? Imagine if you went to work and you worked 40 hours a week and you got a check for 20 hours. Eventually, probably within the first, probably 2 weeks, you would think about finding a new job. But this is our career. This is what we love. And it literally tears us apart that we have to start making decisions because the government or because entities within the government are not doing what they're supposed to do. So if you have something that you would like to comment about, comment. I've shared this with newspapers. I'm trying to get the word out that the Medicaid system is broken in Maryland. And it's not for everybody. Like, the facilities are doing well, but it's the private people, the people that's at the ground, that's literally on the ground doing the really hard work with no oversight. Like, we only get money whenever we're fee for service. So if we don't get paid, we got to figure out how to pay the light bills, all of our insurances, malpractice insurance. We got to pay all of that because they never stop. We constantly got to pay that in. And if we're not getting what we rightfully owed, there's a problem. Mary Ellen, I thank you for constantly being you. You've been a friend to our family. You've always been a friend in this industry. And what would be the last thing you would like to say to our audience, just about anything in your life? What would you say that would help motivate people?
Well, because we're focusing on the deaf community, I would just say, like, when you're out and about in Frederick and you see deaf people, you can always smile and just wait, just be friendly. That's all I would say. And in the stores, if you see, them signing, just being friendly, because the deaf population and the culture here in Frederick is a big part of who we are. And so just embracing that and just encouraging them is a great thing to do. So thank you for listening to me today. And my love, I have like a strong love for the deaf community. Thank you for listening.
I can tell by your smile how much you care about that community. And you as people, try your best to support the people that are at the bottom, that people seem to overlook, because that's what this is about. This tapings, every taping that I do, it's about the people that are not being heard. And there was nobody nobody better than Mary Ellen to discuss about this population. So I thank you guys for tuning in, and I thank you guys for making this exactly what it is. Subscribe to YouTube. It goes up on YouTube. Like it, comment. I love to hear your voices, because your voices gives me new ideas of what I can do to help you guys. All right. So it was good to see you. It's David Brooks, is the Cadillac Counselor. Take it easy.